Bonjour, bonsoir, dear friends, and welcome to JCB Live. This is a happy hour in the heart of San Francisco. I have the pleasure to have many great friends in the medical field, and there's one in particular I really wanted you to meet today, who is one of the most renowned world plastic surgeons. His name is right here, Professor Bryant Toth. Unbelievable. Dartmouth, Brown, Harvard, and all the best in the world, including Paris and Italy as well. He's one of the most acclaimed plastic surgeons in the world, doing everything you can imagine. I call him the Michelangelo, the Leonardo da Vinci, the Rodin of the world of plastic surgery. He's so kind to welcome us in his practice. He is doing a big surgery tomorrow, but he said, come on by for happy hour. We'll have a few glasses of wine and I'll show you what we're doing and how we're doing. So it's a huge privilege. So I'm gonna knock the door and hopefully he's there and we're gonna have the time of our life discussing history, heritage, medical field, art, and what he does in terms of the transformation of the human being and giving back dignity at all levels. Professeur.
Oh, bonsoir mon ami.
Bonsoir.
Bienvenue.
Merci beaucoup. Dear friends, this is Professor Toth.
Nice to be here.
Well, we're delighted to be in the practice of the master.
Thank you, sir.
I called you, I know you heard, the Leonardo da Vinci, the Michelangelo, the artist of the body.
I'm honored. Honored to have you here.
Well, thank you so much. You know, we've had the pleasure, dear friends, to be friends for so many years. But you know, we meet in Napa Valley because you have a beautiful house there. And we meet in San Francisco, but not enough in this beautiful world
that can be corrected.
Yes.
And we shall correct it. Thank you.
Santé. So, Professor, very exciting time today. We are here at the culmination of how many phenomenal years of practicing medicine?
I mean, I'm happy to share my journey, my experience. I truly love what I do. Plastic surgery is a long journey. Remember, you have college for 4 years and medical school for 4 years. But then you have anywhere between 7 and 9 years of surgical training. And in my times, you had to complete, for plastic surgery, full general surgical training, which I did in Boston at the Massachusetts General Hospital, where I also did my plastic surgical training for an additional 2 years.
Wow.
So that's 8 years. And then I chose, from Harvard, I had the Kazanjian Fellowship, chose to go, could go anywhere in the world. I'm not stupid. I chose to go to Paris. And I worked
Here we go, a little French background.
I worked with an extraordinary surgeon by the name of Daniel Marchak. Mm-hmm. And also spent time with Paul Tessier. And they were the pioneers in the world, 2 Frenchmen, of something called craniofacial surgery. Craniofacial surgery, in short, is the procedure of, by making an incision across the scalp, taking the frontal bone off, moving the brain out of the way, changing the facial bones to change facial appearance. For the most part, for children born with facial deformity. Wow. Children born monsters, if you will, who are intellectually normal, and taking them to make them look normal. And that's has given me an enormous thrill for the past 35 years to be able to share what I learned in Paris and then to grow it in my own practice here in the Bay Area.
I could see you've brought back a lot of beautiful pieces from Paris.
Well, it was
from the furniture.
It was an extraordinary year. Also brought back a pregnant wife. So our first child was conceived in Paris, and the 2 months after I started practice here in 1984, daughter Alexandra was born.
Wow. And would you consider Paris a very fertile and city of love?
Well, of course. What an extraordinary time to live in Paris. It was 10 francs to the dollar for an American. We had no obligations at home. So other than learning, studying me, broadening my horizons, I had great background prior to going to Paris. So I was able to see and sort of take in and combine that with the excellent judgment and surgical skills that was given to me during my training, and take it and run with it in San Francisco.
When did you get the love of wine? Because I know as you were in France, you went to Burgundy.
Went to Burgundy, went to Bordeaux, went to Alsace, went to the Rhone Valley. Literally we've always had a love of wine, but I'm an East Coaster. But that year in Paris certainly allowed me, with certain amounts of time off, to sit back and enjoy the treasures of France.
And the gift of God, right?
Yeah, truly the gift
of God.
And
as we're going to enter your world, we're in this magnificent place in San Francisco that is your clinic. So what really made you want to do what you're doing? How in your life you said, this is going to be medical school and I'm on the plastic surgery side and I'm going to do that? What?
Jean-Charles, when I trained, first of all, it was important that I get the best training that I possibly could. And I was fortunate that I matched or ended up at the most extraordinary hospital in the world at that point in time. When I trained, plastic surgery, and it still is, but very much so then, was the most dynamic specialty within surgery. What the layperson thinks plastic surgery is entirely vanity. And I do a lot of vanity surgery in my practice, cosmetic surgery, but they forget that transplantation surgery came out of plastic surgery. One of my professors, Joe Murray, a plastic surgeon, won the Nobel Prize for the first kidney transplant done in identical twins.
Wow.
So that all came from the skin graft rejection phenomena. So now as we see these incredible transplants, including facial transplants, as well as heart and kidney and lung and liver, all that came out of the plastic surgical world. Craniofacial surgery, which I pursued, the concept of being able to basically go transcranially, move the brain out of the way, break the bones, combine some dirty spaces and clean spaces, and not increase the risk of the procedure. Microsurgery, Harry Bunke here, in terms of sewing small little blood vessels together to transfer parts of the body to the other part, not to mention cosmetic surgery. And over this period of time, there have been enormous advances in cosmetic surgery. I had the privilege, when I was working with Daniel, the man that was the father of liposuction, Yves Girard-Deleuze, worked in the next operating theater. And I translated nearly all of his early articles from French into English. And he became a dear friend.
And we're talking about the fathers of amazing evolution of medicine.
And remember, as you look at surgery done throughout the world, liposuction is either at the top or the second most frequent cosmetic surgery done.
Is it?
It is.
And now, why, as you're going to show us where everything happens, why France and Italy? Because you really not only pursued an education in the United States, but as well, in Paris and in Italy as well. So why all that?
I've always been a Francophile. So that opportunity, I had to speak French to work where I was. And my French just got continually better. In the evenings, we wouldn't hang out with other Americans. We'd hang out with our French friends, who were friends still to this day. My old medical school professor, I'm answering that question, was an Italian. And after I'd finished my training, he was a plastic surgeon. He said, Bryant, help me put together a group of friends that are Italian and American. Let's help the Italians raise their level, and let's sort of share everything they have to offer and we have to offer. And learning a second Romance language after speaking French was not a difficult maneuver, and it's paid enormous dividends.
For sure. For sure, and you've practiced and received,
of course,
the highest honors in those countries as well.
I've been blessed. You know what? I love what I do. I share. I've trained I probably have trained close to 100 young people that have come here from anywhere from 3 months to 6 months and then gone back. I mean, the tradition in France is not necessarily to take the young person and show them how to do it hands-on. In Europe, not infrequently, I like to say the professors eat their young.
Really?
In other words, they're frightened of the next generation being better than they are.
That's right.
And in this country, the sign that you've been successful is that you take a young person and train them to be better than you have.
Mentorship.
Exactly. And that's the most important.
And you mentor a lot of young, obviously, doctors.
Exactly.
And you teach.
I teach regularly. I have residents. So I've had these European and Asian fellows come continually for the past 35 years. Vietnam was a spot where I've spent a lot of time. In 1985, John Constable, my professor, was an expert in Agent Orange. So he and I started going, and that was the poorest place in the world.
By the way, I'm just looking down, and here it is. Bryant Toth, an atlas of orbitocranial surgery.
Yeah, that's the idea of the breaking the bones. And
wow. Well, you're going to explain us that inside.
Happy to.
So, Bryant, you're very wine proficient. We're starting with Burgundy here. A little taste of Chardonnay and Pinot. How would you describe that in a romantic medical world?
It's delightful, charming, refreshing. I've not had I've worked all day, so now at nearly 5:30, it's sort of nice to sit back
happy hour
and have a little bit of effervescence. It's magic. It's magic in a bottle.
You. Well, maybe I'll give you a little more.
I like that.
So, Dr. Toth, tell us about. So we arrive here as a patient, and you are practicing here in this beautiful office, so to speak, clinic.
This is my one-person clinic, although I have a staff of 5 others that are here. Operating room nurse, circulating nurse, my office manager.
And you practice as well at UCSF.
I run the program for facially deformed children at UCSF at the medical center in Oakland.
Congratulations.
The Children's Hospital.
Wow. Very impressive, dear friends. So
it's interesting stuff.
I think we need to follow you into the room.
With pleasure.
And then we could talk about all those great topics that are the world.
With pleasure.
That you lead. Ooh, a little. So you play
play the bagpipes. You'll see them hanging in my office.
And this great piece of art is your son's gallery,
My
correct?
son has a gallery in Manhattan representing contemporary Cuban art. And the New York Times wrote an article on him about a year and a half ago, the man bringing contemporary Cuban art to America.
I think it's fantastic.
So he represents some extraordinary artists that I'm sure many of your viewers would love to see in the future.
Absolutely. Well, we should get him on the show.
With pleasure.
Is Cuba now opening? Is it finally?
Cuba's shut down again, unfortunately. The most recent administrator shut it back down. And those that are suffering are the artists and the creative
So how
world.
does he succeed to bring them into the
Well,
US?
a lot of this was brought in prior to it being shut down. And remember, there's no tariff on art.
Yes.
The beauty of I know it's true in this country, I don't know about other countries, but you take a piece of art, unless it's something that's treasured and forbidden to take, you can bring art into the country without a tariff.
So that's a good thing.
That's a good thing.
After you, I'll let
you.
you show us the way into the room
With
of
pleasure.
magic.
With pleasure.
Who is one of your favorite artists of all time? When you look at the human body, I mentioned Leonardo da Vinci because we're always so impressed.
Well, Michelangelo, Leonardo da Vinci. I mean, I love them all, and it all depends. I love the artists from the Renaissance. I love contemporary artists.
Yes.
When I was in Paris, I also translated the book. Raul Tubiana was a hand surgeon in Paris, and his best friends were Alberto and Diego Giacometti.
Wow.
So I love. So Alberto had passed away, but we spent a good bit of time on the weekends with Diego, who is working on all of the pieces in the Picasso Museum.
That's right.
You go to the Picasso Museum and the chandelier.
That's right.
All of the meubles,
the rails,
everything
the
was
chairs.
Everything was hand wrought by Diego, and
I'm very impressed.
Today, he's every bit as appreciated as his brother.
One of the
Alberto.
top sculpture of all time.
Yeah, exactly.
All right. Ooh la la.
So my patients start in the waiting area where we started, and they register, and then they're brought back, and we will finish this afternoon in my office, but I talk to them in the office.
Yeah.
I then see them in the exam room. So on a morning of surgery, patient will be seen and then brought across the way to the operating suite here. So it's all inclusive. We are not going from here to the hospital. It allows me, as an anally compulsive surgeon, an attention to detail person like this man is, attention to detail, it allows me to control who their anesthesiologist is, who the scrub nurse is.
Of course.
I don't want to have people rotating in that don't know or have not had any experience in what I do.
That's the key.
That's important.
Wow.
That's how you can achieve excellence, by working with people. You take where you were the last time and then
Yeah.
drive it up a notch.
Yeah, well, maybe we should talk about
Okay,
the
with
meaning of
pleasure.
excellence after
pleasure.
you. So we now in the temple where everything happens, where the artists sculpt, refine, and embellish. But what's the true meaning of plastic surgery?
Plastic. The word plastic comes from the Greek word plastikos,
Okay.
which means to shape or mold. And that's essentially what we do every day in our specialty. We shape and we mold. So it has nothing to do with any sort of plastic material. It's an old specialty
Yes.
that really went back, if you see old, remember the dueling with swords, Tagliacozzi in 1496. You see
That's
the
right.
portrait of the nose being made from the tissue from the forearm.
I see that.
But modern day plastic surgery really began in the beginning of the 20th century. In the 1800s there were advances, but no real advance until the advent of general anesthesia, because so much of what we do today requires sophisticated talent here, maintaining the airway and keeping the patient pain-free.
That's this.
That's your anesthesia machine. The turn of the century, the First World War, remember, it was quite primitive. You had a line of the Germans and a line of the French and the Allies standing up and shooting one another.
Yes.
And so the facial and head injuries were extraordinary. And a lot of the real advances of putting facial bones back, making new faces, if you will, go back to the First World War.
So that's really the turning point.
Was a major turning point. And then with antibiotics, with, I might add, I had the privilege of the Verestad Kazanjian, a surgeon who was actually a dentist during the war, went back to Harvard Medical School. Their family put together a fund. So what allowed me to go to Paris in the early 80s was as the Kazanjian Fellowship. And he almost single-handedly taught the European facial surgeons and the American facial surgeons how to put these bones back together. I'll never forget, there's a story about Kazanjian, who was a medical student. Remember, he was small, he was Armenian, he looked different in Boston with the Boston Brahmins and what have you. And they had he was a medical student, and there were two British professors. And they threw up in grand rounds in medical school a facial fracture, something. And they said, and this is written up in the beginning of this facial fracture book, how dare I try and describe what to do here when the man that taught us how to do it is in the back row as a medical student.
That's amazing.
So here again,
Well said.
wartime is a time when surgery makes great leaps and bounds, vascular, repairing arteries that are cut in half so you can save limbs. But plastic surgery, so with the anesthesia, with cosmetic surgery, it was quite primitive then. I mean, the past 40 to 50 years, plastic surgery has really come into its own. As I said, craniofacial surgery, microsurgery, the treatment of burns, which is also within our specialty, but particularly in cosmetic surgery.
And so, what has been the evolution of the last 50 years, since the Second World War, and how is it evolving now? Because fortunately, you could create magic with so many examples, and I hope you're going to give us the large vastness of
what
your
happened
skills.
early on is that there was mentorships, where a mentor and a mentee, almost a preceptorship. So what evolved in the 60s, late 50s and 60s, really the last 50 years, were training programs.
Yes.
Where, for example, UCSF, where Harvard, where Yale would get a series of and create a program where anywhere from 3 to 6 people each year were trained in that specialty, making sure that they were properly trained in all aspects, either taking care of chronic wounds or taking care of hand surgeries.
Which is what you could do on this table.
We can do anything on this table.
Really?
Yeah.
So in this room where you are, anybody can come. Let's say World War III, you could pretty much attack any subject.
I pretty much can. The reality is to do something here, the patient really has to be healthy going into it. Mm-hmm. And although it's a complicated, sophisticated procedure, you're not changing their, where they need sophisticated intensive care units. So I do facelifts, eyelid surgery, breast, abdomen, you name it, liposuction, all gets done on this table.
On this table.
Correct.
So what do you like the most doing?
Well, I love what I do. I have passion for what I do.
For sure.
I hope that comes across.
Oh, absolutely.
Because I truly love what I do. You operate, in my specialty, your age contemporaries seem to flock to you. So when you're 30s or 40s, you really focus on breast and liposuction and abdomen. But once you're over 50, I love facial surgery because I take care of these children with facial deformity. I love taking a woman or a man who wants to come in and have their appearance changed, knowing I'm going to do something that is permanent and that it's going to turn the clock back 8 to 10 years, but it's also going to make them happy. There's a lot of instant gratification in facial surgery.
Mm-hmm. And in that, what is your most exciting, fulfilling area of your field? Is it more what you do with the children? Is it more what you do with a person who may have been burned to a very high degree?
No, I don't take care of burns, although I was trained in it years ago, and I have an enormous amount of respect because burn injuries are devastating.
Yes.
I love what I like about my cosmetic practice, I have total control.
Yes.
I have control over your anesthesia, I have control over your nursing, I have control over your perioperative care. I love, the instant gratification. A child comes in with a cleft, and I change that face in an hour and 20 minutes. And I bring the child out to the waiting room, and mom is waiting there, and her child now looks normal. That, just to see, and you see the tears running down their eyes. And even overseas, I can remember in Vietnam, where I was with my wife and 2 children, and they happened to be there in the recovery room. And just to see this child who was older, because they didn't have the talent at the end of the war, he was 8 or 10, I don't remember, but to bring him out after the surgery and see how their face was changed.
What is the most difficult procedure you've ever done that brought you the biggest amount of personal reward?
Oh, we all have career cases, if you will, that you'll take to your grave and remember all of the thoughts and struggles. I have a handful of those, but in general, somebody with with an enormous facial cleft, with the eyes on different levels, with the part of the brain exposed on one side, but intellectually normal.
And the part of the brain exposed as well.
Covered with skin, but not covered with bone. And taking that child and taking the 2 sides,
if you could show us,
if you will,
what you mean here. So this is very exciting.
This is an adult.
So this is the brain.
This is an adult skull.
The skull.
So here's your skull. Here's the inside of the skull. So what you do in these kinds of procedures, you
see, I'm a good assistant.
There we go. You'd be a great assistant.
Yeah.
So you go, and the brain's here. So you move the brain out of the way, and you break the bones.
What do you mean you move the brain out of the way?
Well, you just
push it.
Yeah, you gently push it. You gently put it. Remember,
so you have a great sense of touch.
But the brain is like a little bit like Jello. So you have to be gentle. You cannot. And then you break the bone. So if you're going to move the midface out, you come across inside the brain. Here's the roof of the orbit. You come down on the sides here and here. So in answer to your question, it was a child where the one eye was here, the other eye was here.
Yes.
There was no nose, or it was sort of split. And I took the cleft, put it together, and then came back, 8 months later, and went transcranially and took both sides and brought them together.
And you planned that. You said, okay,
Totally
it's going to take
planned.
7-8 months.
Totally planned.
You must be a fabulous drawer.
There was a time in my life I wanted to be an artist.
Yes.
I certainly an image, and
obviously.
It's all, creativity, and molding and change. Creativity. Yeah. The beauty of my specialty is in many surgical specialties. You go to the textbook and say, well, how did my professor, the generation before do it? We know how they did it, but in our specialty, every time you go to the OR, you're generally doing it and dealing with it differently. Mm-hmm. And then, yes, you're following the good surgical judgment that they gave you, but then doing it to change how you treat a difficult problem.
So why do we have always this obsession of the evolution of our faces, of our body, and we want to just alter, change, and keep remaining 10 years or 20 years younger?
Well, there's, regenerative medicine is pretty exciting. Stem cell research, regenerative medicine, the regenerative ability of fats. I mean, we're looking at, with liposuction removing fat, we're adding a lot of fat now. We're taking that fat and spitting it down where there's stem cells in it. Obviously adding it to the face. I probably add fat in 90% of the face slips I do.
So you liposect it. You have the machine down there, right?
Machines here. You liposuck. Yeah. You take it out. You spin it in that
centrifuge.
In the centrifuge right there. Ooh. You separate the supernatant from the broken up fat globules and transfer it to a little tuberculin syringe like a lady would have if she's having Juvederm or collagen or something like that.
This is so clever.
So that does appear to improve the quality of facial skin. We make breasts out of fat, or change if someone has asymmetry or deformity, or lost a breast because of breast cancer. You can, in the combination of an implant and one's own fat around the implant, can make it look normal.
And what is, for you, the breakthrough you want to see happening to add another dimension to your field? That you're on the verge of breaking eventually.
Mm-hmm. It'd be nice to do some of these complicated procedures through more minimally invasive techniques, so they don't need a intensive care hospitalization. We've made great strides in cosmetic surgery. I like to overnight my patients with a nurse, but they go home.
Yes.
So I do someone's face and neck and brow and eyes. They recover here.
Yes.
So they recover across the hall. But then they go home with another one of my nurses who spends the night with them either at a hotel close by or at home in their own bed.
Oh, really? Wow.
And by the next morning, patient feels awfully good. They're walking around. Not uncommonly after you've had all that facial surgery. You can go out to dinner a couple nights later. I don't want you exercising or bumping up your blood pressure or getting a massage and being your face down or doing yoga, but we've cut recovery times way, way down.
Have you ever said to a patient, I cannot do what you want?
Oh, you have to be very careful. You have to be a psychiatrist in my specialty.
Yeah, how much of that in your office, where we're going to go shortly, happens?
You have to make sure that you can exceed what the expectation of the patient is. In other words, you are in for problems if the patient's expectation can never be realized by what you do surgically. So you have to select your patients well. There are lots of red flags, if you will, in plastic surgery. So you're as much a psychiatrist. You listen to what they want. There's no obligation for you to be the one to operate on that person. And regularly, if I don't think I can exceed what they're looking for, or if their expectation is unrealistic, I will not operate on them.
And how do you deal? You've obviously been extraordinarily successful. But obviously we all have in our life challenges. And how do you deal with an unsatisfied patient?
With a difficult patient? Well, you try and make the diagnosis ahead of time so you don't have to. Complications happen. They're rare. They don't happen often. Mm-hmm. The sign of a good surgeon is how you deal with your issues like that.
Yes.
You certainly hold their hand. you let them know. And most problems that I've ever generated, I can correct, and thank God they don't happen very often. But you hold their hand, and with good surgical judgment, you have to, you can't rush in to correct a problem that has occurred. And I frequently correct others' problems, and the biggest mistakes you can make is to operate on someone when the scars are fresh or there's lots of thickened tissue deep down. So, they have to trust you. You have to gain their trust and say, I saw this awful woman whose upper lip was torn off by a dog bite, and she came to see me because she knew I did. And I said, we're not going to touch this for 9 to 12 months, but because we got one shot to make it as good as it possibly can be. And right now, just feel your lip, that scar is thick and indurated, which means thick and red and what have you. We have one shot at doing it correctly, and they,
And you said I want to wait 9 months.
Right, and she did, and with one operation, we corrected her problem. She looks wonderful.
Because how much of what you do is actually just purely what you shared with us so well, vanity, in many ways, to obviously incidents like those?
Well, remember, vanity implies in all aspects of plastic surgery. It depends if you're making someone who's already good better, or you're taking someone that's been hurt and making it good. So vanity applies to all of it. At this time of my life, I'm doing 60 to 70% vanity, and I'm making my living, if you will, doing cosmetic surgery. I just have the great joy of dealing with children born with facial related deformity. So I stay involved in that. I run the program. I love the challenges, and I get examples sent to me from all over the world from other colleagues. Bryant, what would you do in this case? Will you come over and help me do it? Can we go through the case with you on Zoom or on the phone?
And this is what's happening now in Europe. You're consulting for a variety of very unique situation, and which will take multiple surgery to get it to where you'd like it to be.
Having that time in France made me a real internationalist. It made me realize that we in America do not have a monopoly on all creative talent in medicine, and particularly in plastic surgery. So I have extraordinary friends literally all over the world that I've collaborated with, that I've socialized with. Pre-COVID, it was not unusual that I was in Europe 4 to 6 times a year.
And South America.
And South America, in Brazil, in Southeast Asia.
Is there a computer system, as you talk to someone comes to see you with an issue on their face or their body, or eventually just purely, I want to look 25 years younger. A computer program that really takes in and shows you where you're going to take them.
There are programs, but they're deceptive because they only take into consideration, it's like taking you can take a photograph and add and subtract on many of the programs on your iPhone.
Yes.
But it doesn't take into consideration the variable of contraction of what the underlying bone structure is.
Yes.
You have to be careful because when you do that, it suggests an outcome that you may not be able to realize. It's commonly done with nasal surgery, for example. Someone comes in, they want their nose changed.
Yes.
And you can very easily sort of add and erase on most common apps, and there's special ones for the nose, but you just have to be careful.
You never alter, by the way, talking about the nose, as we're going to go back to wine for a second, 80% of wine tasting is through your nose.
I'm aware of that.
Do you ever, well, I'm sure you don't, but the danger too when you do surgeries to alter the ability of the nose.
And not to mention a singer. When a voice of an opera singer, so much of it is the nasal tone that comes out. You have to be careful, and you have to assess what they're, what they do for a living, and make sure they know there is that risk that is there.
How many variables is there in this amazing creation that is this gorgeous thing that you deal with?
Well, the variables are, anesthesia is extremely important.
Yes.
And I like to tell patients that there is almost aesthetic or cosmetic anesthesia, where they lightly put you to sleep.
Yes.
You're using local anesthetics in terms of in the skin, but that you're not woken with a large drug hangover at the end of the case. and that they can raise your blood pressure. You know, say you've done one side of your facelift and you want to make sure that all the little bleeding has stopped. You want them to gently raise your blood pressure to make sure that you can see any small little. That's why the next morning, frequently patients don't look operated on. They just, you know, their skin's in normal position, they're not puffy and swollen. And then you drop it down again when you do the other side, and before you're closed, you have to, there's an art form in anesthesia, and you don't want patients nauseated, because if you've had facial cosmetic surgery, you know, when someone is nauseated and vomits, that's all pressure and they're gonna potentially bleed, and you don't want that.
So much going on to it. It's incredible.
It's very exciting. It's, you know, I hope you can tell by the tone of my voice, I'm still excited about what I do when I wake up in the morning.
And what makes you so passionate?
Creativity and challenge. Every case is a different challenge.
Yes.
You know, I think about it at night. I think about it, I'm sure when I'm sleeping too. I'm saying, well, you know, because there are different approaches, and you want to, you know, do the least amount of harm to realize the result that they are hoping for and that you intend to deliver.
How do you manage, by the way, within your physical balance, to be so still, to be so precise? Because, you know, many of our friends, the surgeon, it's always the challenge, you know, the right movement. And here you're dealing with a precision level. There's no eraser as you draw or you paint.
You can't take a break from doing it. In other words, you can't be a surgeon and then do something else for a year. For example, I can't be a surgeon except being ambassador to somewhere and then come back and think I could operate again.
Yes.
Because it's
a continuous process.
You have to continually work on your art. You do learn just how you hold the instruments, how you position your hand, so you have a nice fine.
For sure.
And that's you know, your instrumentation is important too. I mean. The other issue of operating your own operating suite, all of my instruments are the best of the best. The scissors are sharp.
And they're yours.
They're mine, and they're looked after like my most favorite toys.
Yeah. Well, let's keep going into the master, the professor's office. Now we're going to talk about the meaning of all this.
All right.
So now we are in professor's office. Books, inspiration, paintings, gifts, amazing images, and we found a little wine from Burgundy because this is where you had one of the first powerful kiss with your beautiful wife.
Exactly.
So all this monumental education, history of medicine, I mean, a true inspiration. Why are we so good at where we are at this stage? What, you know, give us your interpretation of this, and then obviously your contribution to this amazing world as well, because you've written thousands of pages on the topic.
Well, happy to. In medicine, we stand on the shoulders of giants. We stand on those teachers that gave us everything they knew, and that combined with the change in technology hopefully will allow us to pass it on to the next generation. No different than the wine industry, Jean-Charles. I know you learned about the terroir and the effect of climate and soil and the type of varietal and type of rootstock you chose because of your experience with your father, with your grandfather, with the neighbors that were there. So medicine very much is dependent upon those that led you and their ability to serve as mentors and teach. You know, their compassion, their desire to give back to those that don't have. We acquired all of your ability your compassion to each other. We model ourselves, or I have tried to, after those specific individuals in my life that demonstrated those qualities.
Is there even a profession that is so incredibly sharing that your profession? I mean,
what's amazing about medicine is that we continue to learn.
Yes.
You never have mastered medicine, so you're always a student. And medicine is a science, but it's also an art.
Yes.
And the art within plastic surgery may even be larger than the art in other aspects of medicine.
I really believe so.
But to be continually stimulated by a new problem and a new challenge, you're blessed. You're blessed. You never get bored if you stay in the game.
And within the game, what is the area you'd like, Professor, to see the greatest progress to happen? You know, as you would ask me on one, I would tell you that, of course. And in your field, you obviously master it, but where would you like it to see go further? And how are you, in fact, as well, helping to get there?
Regenerative surgery has made enormous strides in the past 5 years. Stem cell research, being able to grow an organ or a necessary part.
Amazing.
And then use it and employ it in medicine. The ability to add stem cells to an area of radiation. You know, radiation cures many things, but it also leaves some incredible sequelae, like non-healing skin or someone that's had radiation on the breast. It seems now if you use fat that has been spun down with appropriate within its stem cells, that it results in healing that would not have healed otherwise.
I see.
So regenerative medicine clearly is the future. Now, the type of stem cell that we use, really to a large degree has been found in fat. So fat has revolutionized plastic surgery. Initially, for the past 40 years, the first 25, removing it,
yes,
and now taking it and either spinning it down or isolating stem cells and then adding it back to the body.
That's absolutely
so.
brilliant.
So here's something that most of us have an ability to donate.
Yes.
So fat has made a difference, and maybe you see an area that needs to make enormous progress. You know, burns. Burns are a devastating injury, and you see these kids. I see these kids overseas. You know, when it happens, the best you can do is restore function. You can never make it look normal. If it's a third-degree burn.
Yeah.
So maybe some of this regenerative medicine.
But there's skin we can take from our body and multiply now.
Exactly.
And
you can culture. You can culture skin. A lot of that was being done in Boston when I was there at MIT and combo MIT Harvard. Yeah, there's enormous work and strides being made. But again, we don't know all the answers, and there's some amazing minds that are doing outstanding bench work, research in the laboratory to.
And which area do you collaborate the most as having a phenomenal operational practice on a practical way with research, where you think your contribution will be the greatest over time?
Well, so again, the challenge of my life has been facially deformed children.
Yes.
I've taken that and developed a very successful cosmetic practice, but being able to do some of those procedures that have risks and being able to do in clinical research, do them through smaller incisions, do them so that the recovery time is not as long, do it so they aren't really sick and need to be in the intensive care unit for a lengthy period of time, or being able to identify some of these problems in utero, if you will, and be able to deal with it in utero.
That's amazing.
And then,
so can you actually, forgive me to interrupt, but Professor, can you actually, within utero, fix it?
One of the great fetal labs is at UCSF.
Okay.
For facial deformity, for a cleft, for example, you don't do that because the outcomes are so good and you don't want to potentially harm the life of the mother or the life of the unborn child. So it's not done for that, but for things like diaphragmatic hernia, when the abdominal contents are up in the chest and that child won't have a developed lung on that side, yes, they go in with life-saving procedures done in utero.
That's
Mike Harrison, who was a resident at the Mass General 4 years ahead of me, came out here and really was the pioneer at UCSF and in the world for fetal surgery.
This is brilliant. I mean, doing it at that stage.
Yeah.
So,
and doing it safely.
Talking about taste and senses, you're a man of senses. You live in Napa Valley and San Francisco. So you're a man who has a tremendous understanding of senses. Food, you're a true hedonist, and wine. So we wanted to bring you an emotional wine, Gevrey Chambertin, Les Mureaux, the feminine side of Burgundy. So, Doctor, would you please describe the wine for us within the terms of your...
Well, you know, as a grower,
That's right.
as a grower, I'm not always there for the blending of the fruit that comes off of my property. But this is a very gentle, delicate wine. It's one of which I could drink a lot of because it is so wonderful. It's fruity enough.
Yes.
The color is beautiful. It tastes like it has a little bit of, well, it's 2017, so it's got 4 years of,
That's right.
2 years in barrel, probably.
Very young still. We're dealing with aging
very,
in wine too.
But very drinkable, wonderfully drinkable. I happen to be a Pinot lover.
For sure. Well, afterwards we'll go to the Tiger because we'll go to Napa Valley. But what is, do you think, a human obsession about aging in general? I know in wine we love aging because the more wine has aged typically. I mean, this is very young, this is a great vibrant vintage. But tell us, as you talk to people all the time about, on the other side of your practice, which is more, you know, the feel, the look, the vanity as you defined.
Well, people come in saying, most people are not unhappy with how they used to look.
Okay.
But what happens with age is that gravity pulls everything down. So the jowls, the bands in your neck, women's breasts drop down, the abdomen goes down.
Is it really gravity?
To a large degree, it's gravity. You have to take care of yourself. But a lot of it's gravity. You cannot. This is gravity.
You cannot basically force nature to go against that gravity.
Well, remember, we have we're biped animals, so we've stood on 2 feet since we were 9 months, 10 months. But if we spend half of our life walking on our hands, we wouldn't have. But it's the fact that it's been subject to gravitational forces.
Shall we go back to 4 legs? Is it what you suggest?
But you got gravity.
Yeah.
You have environmental aging, wind and sun.
Yes.
That's the skin quality, thinning of the skin. You know, a lot of the keratoses, a lot of some of the pigmentation. And as we get older, we lose facial volume. We lose fat. You look at everyone as you get older, they lose facial fat. It's here and here. It's almost a thumbprint of facial fat that
One thumbprint. Wow.
It's right through here.
Right here, yeah.
And underneath that, we've shown also, research-wise, that you lose bone with age. So that some of the bones in the orbital rim, some of the bones alongside the nose. So ideally, what you do in facial cosmetic surgery is that you deal with the gravity effect, you lift it, you lift the tissue, but you do it through a deeper layer so that tissue is fixed, so it's not, that tension's not on the skin. We've made great advances. You know, if you looked 25 years ago, all the tension was on the skin. It distorts the ear.
That's right.
It results in thick scar. Good facial cosmetic surgery, you cannot see the scars because it's been nicely hidden. But the deep tissue, the SMAS platysma, is like a corset. So you tighten that corset and then just allow the skin to redrape. And finally, you take fat.
Yes.
We were on fat earlier.
Yes.
In 90% of the facelifts I take fat from the abdomen. I spin it down, as you saw in the with the centrifuge. I separate the supernatant from the fat that was destroyed in the process, and inject it the same way you would a filler. And 70% of that fat will stay permanently.
That's amazing.
And it's a nice addition.
Rather than artificial silicones.
Exactly. So volume makes all the difference in the world. And before we started adding fat, 8 years ago, we didn't add fat all the time. All the people that I'd operated on then, I would love to be able to come back. Yes, maybe do something in addition, but I'd also like to add fat to their face because we all lose it.
Now, psychologically, just to go back on the tangent of aging, what's our obsession of wanting to slow down aging or not to accept or not to let it be?
It's an
deep question.
Yeah, no, it's an excellent question. I was going to point the finger of those that have everything. A lot of my extremely wealthy colleagues are almost like Howard Hughes,
Yes.
where they go in this little bubble and think that they won't age.
Mm-hmm.
You know, I think it's the quality of the years that you have rather than the years that you have alone.
Well said.
I know some very wise people have said that, you know, it's not the years in one's life, it's the quality of what goes on during that period of time. Certainly with artificial joints, you don't see, 70, 80-year-old men hobbling any longer. You know, with the knee and the hip, orthopedic advances have been extraordinary.
Extraordinary.
So you just want to keep up with, and remember, people used to retire at 60. Yes. 65. That doesn't happen anymore. Mm-hmm. So you're competing with a younger age group. So you want to look your best. So someone that comes and says, I'd like to look like I did 12 years ago, and I don't like this, and I don't like this. Yes. And maybe, I'm looking a little haggard here because I know I'm going to make that patient happy. Or for their eyelids, they come in, they've got puffs under here. Doctor, I look tired. I've got the hooding over my upper lids, and I've got puffy down here. I know I can make that patient happy.
So basically, the process is a patient comes,
sit right here.
Sit right here. And
now this is pre-COVID sitting. Post-COVID, I sit across my desk from here, so we're 6 feet apart. But pre-COVID, I would sit like you're sitting. I feel like I'm in a living room talking to you, and I try and make them feel comfortable here. So patients brought in, we sit here. I listen to, find a little bit about them, talk about their past health, find out what's bothering them. We talk about the problem a little bit, and then I bring them into an exam room where I can look very carefully and closely with them in front of a mirror to see.
But they tell you what they want.
They tell me what they want.
And how often is it that they tell you what they want and they come out with a very different evolution of recommendations?
I take a little bit of liberty in talking about other parts. I says, you don't mind if we talk because it complements. If you're talking about someone's eyes, the brow has a major effect on it.
That's
if you're talking about the lower
they all
lids,
related.
Right, that is dropped down, the face where you can lift that lower lid skin impacts it. I won't necessarily then, if they're here for their face or their eyes, talk about their nose. Because to me, that's overstepping my bounds. But if they say, well, what else would you consider me
on the menu
doing? Yeah, what else should I do at that time? And that opens.
Because there's a deep understanding of other people and psychology, and this is a major exercise of not only listening but suggesting, proposing. I'm fascinated. So, as you finish your Pinot, let's go to Napa Valley. And I could see in between books, there's a famous man you've actually worked on. And, he actually is not shy to tell us, obviously, that he looks very young. How did that happen? La forza di fatti. Look at that, ladies and gentlemen. We may want to go close on this one. This was a very fabulous entrepreneur who is still a fabulous entrepreneur, obviously, who forever looks young, thanks to you. So how did that happen? Silvio Berlusconi.
The only reason I can talk about it, and I'm not violating patient confidentiality,
which is very important,
is the fact that he talks about it, and he's given me permission to talk about it. I guess it's coming up to 15 years ago, my name had been circulated, and Silvio remember, he was head of state.
Yes.
He not only was the wealthiest man in Italy, he was head of state, and he wanted to look younger, and he said it himself the year later at the year-end press conference. My country looks upon me to be young and vibrant and represent the people well. He said it as well as anyone. I should get that quote for you because it's wonderfully said. And my name was, my daughter was studying Italian in Florence, and my name had come up, and he said, I got a phone call. Will you fly down to Rome and meet the president? Remember, the president of the Council of Ministers runs the country. The Italian system, the president is like the old king,
Yes.
but the head of the Council of Ministers, the prime minister, and we hit it off. And
Really?
sure enough, we had a wonderful time together. And he's become a great friend through the years. I've been to many of his houses.
So he came here to
No.
San Francisco? You did it in Rome?
Did it in Switzerland.
I
Did it in
see.
Lugano.
So you bring your tools?
Brought my tools, brought my anesthesiologist, brought my scrub nurse.
Wow.
Obtained a licensed practice in Switzerland, and they were helpful in obtaining.
Well,
We did it.
you've done that in many other
I've done
parts
it.
of the world.
I've done it many
And
times.
we won't
But
breach
it's
any other...
imperative. It's imperative that we did it correctly in this instance.
Yes.
And remember, when you operate on a celebrity, when everything goes well, all of plastic surgery benefits.
Yes.
If things go poorly, no one benefits. And this was the beginning of really. I like to think I had a lot to do with the interest of cosmetic surgery in men. You know, over the past 10 years, there's been a lot of
Yes.
interest in men, when keeping their jobs, looking young, eyelid surgery, nasal surgery. The procedures may be a little bit different, but he was an elegant man, a joy to take care
Yes.
of, kind and sweet to my wife and my daughter and my entire family. And I spent time in nearly all of his homes.
And I got to tell you, I was living in Europe full time at the time. Everybody talked about how great he looked. And whoever touched his face did an amazing job.
Well,
So,
I spoke absolutely nothing about it until he did, and it's far enough in the past, and he talks about it.
so now I have a question for you that I think everybody's asking themselves. You look at someone's face. Can you actually look at someone without analyzing it?
Yeah.
As I taste the wine, I have to analyze it. I taste it.
I can.
But can you really? Or you
Sure.
just always...
No. But remember, anyone over the age of 40 facially has had gravitational changes and volume changes
Yes.
that you could tidy up, if you will, that you could tighten. Someone who has basic, good bone structure, attractive, but has just had a little bit of too much sun, too much wind, getting up there in years, sure. I look at them in terms of, wouldn't I make an enormous difference if I did something to improve the face?
Because I would love at a dinner, as we were recently together, to be in your head. As you look at every people's face.
But there's an attractiveness to age. I'm not saying that everyone needs to look young.
For sure.
You've aged wonderfully.
Well, there's a lot of
aged,
tidiness to
but,
break. But I'm only 40.
But it's
so you said 40, which is great.
But it's just starting to deteriorate now.
That's
right?
it.
But it's more a question of tidiness.
Yes.
Where you have some age changes where gravity's taken a toll, that doing some relatively small things, volume. If you look at the sheer numbers across America,
Yes.
Neurotoxin, Botox for wrinkles and corrugators. And
Are those good
on the
for
side?
you?
Well, it's a complementary procedure. Yes, they're great. And filler. Hyaluronic acid filler, because
Yes.
for losing volume, there's nothing like replacing like with like, replacing it with your own tissue.
Yes.
But no, they have dramatically changed.
You notice when any given person do it.
Yeah, but
You see it.
when it's poorly done.
Okay.
When it's done well, you can see it. I could see it in national meetings where fellow plastic surgeons had Botox in their forehead that was poorly done. They couldn't move this part of the forehead, and then the two sides overreact to try and recreate the same.
That's right.
The same.
Can you fix
posture. Sure, but just by adding some more Botox, definitely.
So another important question, Professor. Look at those books. God, dear friends, not only has a brain and talent, but you did all those books. We have International Textbook of Aesthetic Surgery with another friend of yours.
This is the same textbook, edited by myself and Niccolo Scuderi, the professor in Rome.
Yes.
Again, this collaboration and it's in Italian and it's in English. And yes, I wrote a lot of what's in it. I edited the entire book, rewrote many of the chapters. But it has.
It's similar to Playboy.
It has the best of the best from both sides of the pond.
Wow, this is impressive. So,
And actually, the Italians made a more beautiful book. I mean, you know, I couldn't. I mean, look at this wonderful piece of art that we have on the Italian book.
Now, what drives this passion of yours? I know you've answered in one way, but can you answer into another way? As far as the advancement, the progress, where would you like all of us in 120 years, as we look at your plaque in your building here, which is very impressive, to talk about Professor Toth?
I would like it said that I made a difference in my life. Something I did and wrote years ago. I wrote the first paper on skin-sparing mastectomy. So we're on the breast now. In the old days, a woman had breast cancer, you take the entirety of the breast off. I, working with several general surgeons, said, this is a breast disease, it's not a skin disease. Let's leave all the skin behind. So the quality, and now we have nipple-sparing mastectomy. We're going to leave the nipple and areola entirely there. It all began with skin-sparing mastectomy, and that was revolutionary. You had to show that you were not increasing their risk of developing cancer. And we proved that, and then it's been embraced and taken and run with. That made a difference. That made an enormous difference. If, you know, 1 out of 7 or 10 women will get breast cancer in their lifetime, that made an enormous difference. Some of the techniques in children with facial deformity, I've written up my technique for facelift, where we're doing a high, strong, vertical deep lift and re-wrapping them, and the women are just ecstatic. So I mean, so I love what I do. I want to continue to do it, but I also want to teach the next generation. And I've had the privilege of having young people from all over the world. Then, you know, when I retire, sadly, my old mentor from Paris died of lymphoma in his early 70s, and he said, when I retire, I just want to go and spend a little bit of time with all those people that I've trained.
Yes.
And for me, that would be, you know, throughout Vietnam and Burma and Laos and southern China and France, Italy in particular, you know, as well as in Greece and in Russia and in as well as South America. I've had many, many Brazilian surgeons that have come and spent time. To me, going and seeing what I taught them and what they adapted from spending time with me in their practice. Switzerland, I mean, I have a handful of professors all over that are now, I gave the 100th anniversary keynote address at the University of Hanoi because the dean had been a fellow with me back in the early 80s. So that, you know, that makes me feel good. And I bring my family. So my kids have been exposed to all these myriad of cultures.
That's phenomenal. Hence the tiger for you.
Yes.
The tiger prince of Napa Valley.
Love the tiger.
The tiger.
Remember, I was born in the year of the tiger.
You were?
Yes, sir.
What a fabulous destiny that we're enjoying it. So this is from around your house. Maybe you want to share briefly what is the wine you're making at your house, because I've had the pleasure to try this marvelous Cabernet. And
This is beautiful. It's a wonderful story. I came to San Francisco from Paris in 1984. Started practice and lived actually just down the street in Presidio Heights. And we had first 1 and then 2 little children. In San Francisco, the weather is awful July and August. It's cold and frigid. And an opportunity came to buy, and my father thought I was crazy, spending, you know, 7 figures to buy a house in the city. And I was, but it was one of the smartest moves I ever did. And then a piece of property became available in the Napa Valley with a panoramic view. And I said to myself, am I ever going to find another piece of property with an entire panoramic view of the Napa Valley?
Very rare.
So we stretched, we built, did it over a slow period of time, finished the house, put the pool in, did the landscape, put the vineyard in, put the walls around very slow process. Planted our first production in 1991, and our first fruit was our first bottled wine was in 94.
And you sell it?
You know, I sell my fruit primarily. I keep 150 cases for friends and family, small
Which I was very fortunate to be
production
the
and sale. But you remember, it's a hillside vineyard.
Yes.
It's wonderful, and we will be dining there shortly. It's a magical place, and as far as me and my family, although we have this great San Francisco residence, Santa Claus always came down the chimney in Napa for both of my children who are now in their 30s.
I love it.
So
well,
I love the Napa Valley. And I'm mentioning this personally. What I love about you, Jean-Charles, is that you promote everything about the Napa Valley. Not just your extraordinary wines, and they are extraordinary.
No, but it's about all of us.
Yes, but the cheesemakers, the chefs, the food, what you've done with the Oakville grocery.
The cosmetic, phenomenal sculptors of the world. Professor, maybe one, and forgive me to abuse of your wonderful happy hour time together, I'd love for you to give a big message to all our friends all around the world. You mentioned Asia, you mentioned Russia, you mentioned Europe, you mentioned Canada, South America. They're with us and we'll be watching. Send a big message of whatever topics you wish to talk about as a big takeaway for all of us, as you such an amazing inspiration.
What I want to, I think the primary message to take away is chase your dreams. Think big. Give back.
Yes.
You can selfishly acquire, but you acquired, particularly in surgery, all these incredible talents. Don't be a recluse and think you're the only one that can do something. Train the next generation to be better than you have been. Open your mind. Travel. Travel has opened extraordinary benefits to me. Anything I've ever done operating in a third world country, helping deformed kids or burned kids, whatever I have given, I've received 100-fold in return by gratitude, understanding their culture, understanding their people. So think big. Life is not a dress rehearsal. So jump in and enjoy every step of the way. And think about when you're gone, you want to leave, you want to help people along the way. Be kind, be gentle, but give back. And medicine, there's not a finer, the beauty of medicine, and I tell young people, a good friend of mine, a dear friend, is Mickey Hart, the drummer of the Grateful Dead.
Of course.
And Mickey and I sit down regularly. We're dear friends. And the beauty of medicine and the beauty of music is that it transcends boundaries.
Yes.
I could go to Vietnam in the early 80s, and there was still bitterness towards the Americans and even some towards the French.
Of course.
It was a debacle for both of our histories. But here I'm bringing talents from this country there, helping people. That I never heard a negative word directed towards me. And the same thing's true in music. Music transcends boundaries.
Yeah.
So take your skills. Wine transcends boundaries. And the more I know, the more I want to learn and know. And, I've had wonderful experiences, in Argentina drinking Malbec at the foot of the Andes, or in Alsace, at one of my favorite restaurants, Auberge de Lille, and drinking some of the local magical wines. My Paris experience, we're waiting for this crazy COVID period to end when we can go and relive those magical moments. And trust me, I'm going to be one of the first. I'm going to be one of the first. And the beauty was I had the advantage of mixing medicine with joy.
Yes.
So when I would travel, I would always try and, go back to one of my favorite places. And yes, going back to Paris, going back to Venice and Rome are great, but also include going somewhere you'd never been before.
Being curious.
Maintain that curiosity. And I think it will provide excitement. Hopefully will stave off Alzheimer's or some of those bad neurological things that many of our friends are struggling with, and that we're certainly potentially prone to receive. But keep your mind stimulated. Read, paint, sculpt, create.
Dear friends, don't you think Professor deserve the JCB jewelry, the Chardonnay grapes, We didn't have any tonight except a little bit in 21. But Professor, just a little contribution.
Oh, wonderful.
Maybe
Yeah,
I'll
put it on here.
maybe I'll do it.
It's going to stay here.
It's good. I hope so. Look at that.
I love it.
Maybe the surgery will even go.
I was a little jealous when I saw it on your lapel when you came in.
I could see you were looking, so you deserve fully. And it's fabulous to have a professor, dear friends, who is such an hedonist and such an inspiration. And Professor, I want to thank you so much for the time you gave us for this happy hour, which was
It was a magical afternoon.
phenomenal.
No.
The sun is setting on us, and I want to say thank you for welcoming us. And dear friends, if you need anything in the world we just discovered, now you know who to call. He's the best.
Thank you, my friend.
Dear friends, I'm very fortunate. I'm with Professor Toth, and you don't hear me too well because I have lips, but I don't have much underlips. So I know you noticed my cufflinks,
Of course.
and I call them Ginny's Kiss because my lovely wife has beautiful lips that I love to caress at all time. Is there something you want to tell us about those beautiful lips?
You know, lips are very important in terms of facial appearance. And as we get older, the lip changes. As we get older, the vertical height of the lip frequently elongates and the lips become thinner.
Yes.
And very much a part of facial rejuvenation when I do a facelift and I'm getting fat anyway to add to the mid face, I frequently will take fat and then add it to the upper and lower lip
I see.
to add bulk, not excessive bulk. Women come in and say, please don't make me look like I was one of the actresses in the First Wives Club, where they have these enormous looking lips which look unnatural. But if you take a picture of how they looked 20 years earlier versus now, you can see the fact that the lip has significantly atrophied. There's lots of fine wrinkles. You know, they come and they complain. I put my lipstick on and the lips run up the vertical creases
That's right.
here and the vertical creases here. But by carefully adding some of their own tissue through small little incisions and the fat that you've harvested from the tummy that you've spun down and with a little tuberculin syringe and a fine needle, you can add it to the lip line and to the bulk of the lip.
So you
To make
redraw
a
the
lump.
lip line.
You basically highlight the lip line.
So you
which
do
is
it
there.
on a piece of paper first, like a painting
No,
or drawing?
because you can't alter the aspects of it. What you can do is you have to accept the fact. Now, if you look at the lip,
Yes.
where's your mask?
Here.
We call the upper lip the Cupid's bow. Okay.
Okay.
This is the Cupid's bow. Why Cupid's bow? Because remember, if Cupid were going to pull an arrow,
Yes.
that's the where they would pull for the arrow.
Sure.
So the vermilion is the red part of the lip.
Yes.
There's the white roll, which is a very fine white roll that we all have that lies between the vermilion and the normal skin color. So what happens as we age? This narrows.
Yes.
These fine little wrinkles occur, particularly in an animated face or if someone had been a smoker. Okay? Having been a previous smoker, invariably they have a lot of vertical creases or they just have a bad gene pool and it's going to occur. So what we do is we augment this by adding their own fat. Through generally, I put a small, like a 0.5 millimeter incision and add volume here, a little bit of additional volume at the white roll. And then if I need to highlight the philtral column, which are these
Yes.
two columns here,
That's
I can
right.
highlight the philtrum
How do we call
column.
those columns?
This is the philtrum,
Filtrum.
and these are the philtrum columns. And this is a cosmetic unit of the upper and lower lip. So it's a, that's easily done. If you're going to deal with changing bony structures and stuff, that's not really in the cosmetic arena. But fat again makes an incredible difference.
I love it. So now,
So look here.
the Gina's lips will never have.
Gina's lips are beautiful. She's
Thank you.
got the beautiful Cupid's bow. Look at that Cupid's bow. Look at those full upper and
And I'm
lower
Cupid,
lip.
of course.
Exactly.
I aim at those lips.
Yeah.
But
But,
it's fascinating to draw lips. It's such a complex matter
It's
because,
it
as you
was-
said, every 20 years we evolve and become flatter on the top
Yeah,
part.
it's true. We
Yeah.
definitely become flatter. And you see in young children, when a new baby is born, I'm not talking about a child with a congenital problem, but you see these children with these beautiful
Yeah.
upper and lower lip, the beautiful Cupid's bow. It's really a sign of attractiveness.
So maybe, Professor, the next piece of jewelry will be designed with Professor Toth, and we will, with Professor Toth, design the perfect lips. Not that Gina's lips is not perfect, it's fabulous.
Gina's lips are spectacular.
Exactly.
She
We
does
will
not,
continue.
she does not need my help.
No.